Imagine a patient pays a visit to your clinic with an old denture and wants a new set of dentures. You as a clinician, advise patient that a new denture can be fabricated using patient's old denture as a guide or template. This type of denture is called as reference denture. Now, let's learn about the reference denture workflow in detail. Make the patient sit comfortably in the dental chair in a seated position. First appointment, clinical assessment, impressions, and records. The clinical steps for reference denture begin with ensuring that there should be no adhesive on the denture surface before making the impressions. Check initial denture by verifying the midline and incisal display in the initial sitting. Ensure the reference denture bases are stable. Ensure the proper coverage. It should not be excessively short in the posterior limit, not more than 5 mm. Occlusal plane is acceptable. If on examination, the following criteria aren't met or the denture is too loose, then consider option 1, i.e. fabrication of a new denture with a digital denture workflow, which will be discussed later on in other module. If the extension is short, extend peripheries by VPS impression material. Use a heavy body medium body compound to create tissue stops on both dentures, as this is essential to maintain the vertical dimension at occlusion. Apply high viscosity impression material to the borders of the maxillary denture. And seat the denture in the patient's mouth and ask them to pucker their lips and then record the borders. Pull the upper lip downward to record the labial border. Pull the cheek in inward, upward and downward motion to record the buccal flange. Create escape holes in the tray to allow excess material to flow out. For the wash impression, apply tray adhesive to the tray and prepare for low viscosity impression material. Spread low viscosity impression material on the intaglio surface of the denture and place the denture back into the patient's mouth and apply firm pressure. Remove any excess material that extends over the borders or occlusal surface to avoid issues during scanning. Repeat the same for other denture. Repair the holes created in the existing denture for making wash impression denture by chair-side repair method by placing self-cure acrylic in the holes and removing the excess. If the fit and aesthetics of the denture are accurate and dentures doesn't require any modifications, then consider option 3, just create escape holes and make a wash impression and repeat the same process. iTero's scanning process begins with starting a new scan. For new patients, click on New Scan and enter the patient's name. For existing patients, use the Find Me option to search for the patient's name. In the Orders section, tap on Procedure and select Denture Removable. Tap on Type, i.e. reference Copy Denture, and choose the appropriate option from the list. To set scan options, toggle Denture Copy Scan option on. Toggle this near-infrared imaging option on if required. Add notes. Enter any additional information related to the scanning process in the Notes section. Here are some tips and tricks for effective scanning. Use of resin markers is particularly essential in edentulous cases where traditional landmarks are limited. Apply resin markers to the palate to establish reliable reference points for accurate image alignment. Titanium dioxide mixed with 99% isopropyl alcohol in a spray bottle can be used to spray on the reflective surfaces of the denture to scan better. Always follow the company's scanning protocol. Remove blue sleeve and clean the lens with a lens cloth, and then place the white sleeve on. For scanning, ensure that the AI cleanup option is turned off. Remove the denture from the patient's mouth. Hold the denture and keep the denture in a stable position during the scan. Start with scanning the maxillary denture. Begin scanning from the occlusal surface of the denture. And ensure that the scanner wand maintains contact with the denture surface. Move the wand slowly and in a continuous pattern to allow accurate image capture. Carefully capture the contour of the posterior palatal seal area. Now bring the wand anteriorly and position the wand on the palatal surface of the maxillary anterior teeth. Move the wand across the palate in a wave-like motion to capture the palate accurately. Skin the occlusal surface of the teeth, then roll the wand towards the buccal side with a smooth motion. Now, use a wave-like motion to capture the contours of the teeth and buccal flange. To scan the intaglio surface, start at the ridge near the posterior seal and scan the intaglio surface in a U-shaped pattern. Keep the wand close to undercut areas to record them accurately. For scanning the anterior intaglio surface, use a wave-like motion to move the wand downwards and towards the posterior palatal seal area. Afterwards, move the wand across the posterior palatal seal and roll it over the buccal flange. Once both the internal and external scans of the denture are completed, the system will automatically merge the scans. Now, begin scanning for the mandibular denture. Start with scanning the occlusal surface of the mandibular arch in a continuous motion. After completing the occlusal surface, scan the buccal surface using a wave-like motion and proceed to scan the lingual surface of the denture. Flip the denture and scan the intaglio surface from one side to the other. To capture the lingual flanges, roll the wand from the intaglio surface to the lingual surface in a roll-out motion. Once both the internal and external scans are completed, the system will automatically merge the scans. Use the scissor tool to trim any unwanted captures, such as gloves or other artifacts. Record the patient bite and centric occlusion if is well established, or remake the bite record and centric relation using bite registration paste. Seat the denture properly in the patient's mouth and seat the patient at a 45 degrees angle. To begin the bite scan, place the wand between the cheek and the denture. Instruct the patient to bite in centric occlusion. Once the occlusal plane is centered, turn the wand on and begin scanning. Move the wand in a wave-like motion throughout the mouth. Once, when the bite is properly recorded, turn the wand off. Repeat the sequence on the opposite side. Include any required notes in the RX Notes section, if required. Once all scans and notes are complete, send the order to the lab. The lab received the denture scans and bite and send a monolithic trial to the clinic. Now on the second clinical appointment, make the patient sit upright in the dental chair. Monolithic trial is checked in patient's mouth and used as a trial denture. It is used to assess the function and aesthetics of the try-in denture. The trial denture is marked, adjusted, and reduced as needed by the dentist. The adjustments are done and marked, and scanning is done for both the dentures just as the copy denture, then it is sent back to lab for final processing. The final denture was processed in the lab and then sent to the clinic. At the third clinical appointment, final insertion delivery is done. Make the patient seated in the dental chair in upright position. Position both the dentures in patient's mouth and check for final fit, aesthetics and occlusion. If everything is fine, send patient back home, or if not, do the necessary adjustments.